I would say to you, get involved. I would say to you, take your experiences and put them into a place where you could make change happen. Communicate, vote, get engaged, and don't throw your hands up and say, I'm not making any difference, because the louder the voices, the more there are, the more impact you can make. And I would never, ever give that up.
Just in terms of when we think about the numbers of people and the kinds of issues, I see it sort of as an opportunity that really the boomers have to be engaged and to facilitate prevention. So I think if boomers would do some things now, we'll have a much better older age and be much healthier than really prior generations.
As a neurologist who specializes in the treatment of movement disorders, the majority of the patients seeking my help are patients with the diagnosis of Parkinson's. Parkinson's was discovered in the late 1800s by Dr. Parkinson's, its namesake. He found a syndrome in a large number of people where there was slowness of movement, rigidity of the muscles and limbs, as well as resting tremor. This really impacted a patient's life. They were unable to get out of bed, sometimes not even able to walk around without shuffling. They would trip on things, they'd have frequent falls, and be unable to do just the activities of daily living that we take for granted. Neuroscientists strove to find an answer to this syndrome. The neurosurgeons were the first to take a shot at it, and they attempted lesioning techniques, which is a type of surgery where there was actual damaging of the brain to help relieve the Parkinson's symptoms. They had some limited success, but due to the limited and fairly crude techniques in the 1950s for neurosurgery, they had as many failures as successes. The neurosurgery aspects of treating Parkinson's really went into a dormancy for another 40 years with the advent of a medication called L-DOPA in the 1960s. L-DOPA revolutionized the treatment of Parkinson's, and it gave people back their lives. However, L-DOPA brought with it a large number of other complications. They would have dyskinesias where they would thrash about wildly, and frequently nausea and vomiting just from the large doses of medications needed. This was partially relieved by the addition of carbidopa in the form of a combination medicine with both carbidopa and levodopa called Sinemet. Sinemet enabled us to use much smaller doses of levodopa but to much greater effect with far fewer side effects. In the late 1990s, we went back to the future and returned to neurosurgical techniques to help us relieve these complications.
Joining us is neurosurgeon Dr. Duma.
This procedure for treating the symptoms of Parkinson's disease was developed as far back as 1951, but the technology, obviously, they didn't have MRI scans or CAT scans to go by, so the technology that they used back then to create lesions and to change tremor was very primitive. Now, as technology has improved over the years, we have MRIs and CAT scans which give us spectacular imaging.
Medtronic invented Activa, a deep brain stimulator device that inserted a thin wire deep into the brain and connected it to a special pacemaker. This pacemaker could be adjusted to help send small electrical current into the brain to relieve the patient's Parkinson's symptoms. At the same time, the patient's medications were able to be lowered for the first time in the patient's disease.
For patients who have advanced Parkinson's disease, stage 3 or 4, we are opting to implant these stimulators. The improvements are spectacular in some cases. Stiffness and rigidity is improved. The patient's dose of Sinemet and medication can often be cut in half because you have a patient who's been suffering for 7, 10 years with disabling tremors or disabling movement disorders, and then in a matter of a single operation, you can alter their lives in such an extraordinary way. It's extremely gratifying.
I had the best life starting at age 50, and I'm looking at 60, and I'm very excited.
I think this is the most exciting time in my life, and I'm 70 years old, and I just retired.